Hello and welcome back to the Career Doctor channel. Today we're diving deep into a topic that is essential for every medical professional: the difference between continuing medical education, or CME, and continuing professional development, known as CPD. Whether you're just starting your career or you're a seasoned practitioner, understanding these concepts is crucial for your professional growth in Australia. Let's start with CME, continuing medical education. CME is all about enhancing your clinical skills and your medical knowledge. So this includes activities that focus specifically on improving these skills in areas such as diagnostic methods, treatments, and procedural techniques. In many countries, healthcare professionals are required to complete CME hours to maintain their licenses or registration. Activities that qualify for CME can range from things like going to a medical conference or workshop to participating in an online course or a webinar. These activities not only keep you up to date on the latest medical practices, but are also essential for meeting regulatory standards. Now let's talk about CPD, continuing professional development. Unlike CME, which is clinical focused, CPD encompasses not just activities to develop your clinical practice, but also a broader range of skills and competencies. It aims to improve not just clinical abilities, but also so-called soft skills like communication, teamwork, leadership, and ethics. CPD activities might include traditional CME activities, as well as other less traditional activities, such as going to a leadership training workshop, or doing some ethics studies, or performing an audit or a performance review, or courses on how to improve your doctor-patient communication. By participating in CPD, doctors can develop a well-rounded skill set necessary for handling the complexities of modern healthcare. One way to think about it is that CME is a key component of CPD. So what are the key differences? CME is primarily focused on your clinical skills. So it's about staying current in your medical knowledge. CPD, on the other hand, integrates both clinical and non-clinical skills, making it more vital for holistic professional growth. While CME helps you to enhance your medical practice, CPD is potentially more crucial for your career advancement, allowing you as a doctor to take on leadership roles and fostering effective teamwork and improvement within healthcare settings. Why do both CME and CPD matter? So the importance of both CME and CPD cannot be overstated. CME ensures that your clinical skills are sharp and up to date, which is vital for patient safety and quality care. In the meanwhile, CPD prepares you for things like ethical decision-making and leadership roles, which are increasingly important in today's healthcare environment. By engaging in both CME as part of your CPD and CPD activities, doctors can ensure that you're not only compliant with your registration requirements, but also that you're actually contributing to improved patient outcomes and a better healthcare system, which is what most of us would want. So balancing CME and CPD is crucial for comprehensive professional development, and we'll talk shortly about how the Medical Board of Australia achieves this. Newly practicing specialists might want to prioritise CME to strengthen their clinical skills whilst dipping into some CPD for future development, whereas senior practitioners may want to focus more on the broader aims of CPD, but still keep up to date with their medical knowledge. So as an example, a new practitioner might focus on CME for advanced clinical training, whereas an experienced CME might attend a CME event for the latest techniques while engaging in CPD to mentor others. Starting in 2024 in Australia, all registered medical practitioners must adhere to a new CPD registration standard, which includes completing a minimum of 50 CPD hours per year. These requirements specify that 25 hours of those CPD must be from performance review and outcome measurement, along with 12.5 hours for educational activities and another 12.5 hours of free choice activities, which can be basically from one of the other categories. I'll put a link to the Medical Board website CPD page, but basically the Medical Board defines educational activities as things like workshops, online courses, conferences, and reading up journals. It defines reviewing performance as things like peer review and quality improvement projects. And then it defines measuring outcomes as things like clinical audits and research initiatives. Engaging a mix of these activities not only fulfills your requirements, but hopefully enriches your professional practice. So in summary, both CME and CPD are important for your growth as a doctor. They help you stay competent, ethical, and prepared for the challenges of modern healthcare. Now, if you found this video insightful, make sure that you like, subscribe, and hit that notification bell for more valuable content on navigating your medical career. Have questions about CME or CPD? Drop a comment below and let's engage.